Welcome everyone. Today I'm introducing Sangini Rane, a physiotherapist who conducted an insightful session on knee health, sharing practical guidance and helpful techniques for stronger, healthier knees. We also had a wonderful session by Reena who guided us through Pranayama and Mudras, helping us understand simple practices to support overall well-being. This beautiful and informative session took place on My World of Wellness, so stay tuned for more such enriching sessions coming your way. For knee pain and expert guidance, contact Sangini Rane at Apex Postural Restoration Center. And if you want to learn more about Pranayama and Mudras and how they can improve your overall well-being, connect with Reena. Here are some information about her. And for more information, tips and updates on wellness sessions, stay tuned to My World of Wellness.
For being here. She asked me to talk about knee health and movement, and I just want one thing I wanted to just point out in the beginning. It's not about just looking at the knee, because how the rest of the body, it affects the knee a lot, and we'll see it through the presentation. So a lot of time, you can't really compartmentalize the body, for that matter, any part. You have it, everything works together. You can't say I'm this specialist and that specialist and keep going to specialists. And that's not how the body works. It works together. So posture, I'm sure most of you do realize that posture does affect it. I'm trying to see how, okay, there we go. So talking about knee pain, is it really just the knee? That's one thing. Yes, when there's an injury, that's a different aspect, yes. Direct injury, you hurt yourself, you fell down. But even then, you still have to look at the whole body, even after that. But most knee pain isn't really caused by just the knee itself. Three main things that affect it are the hips, the strength and the balance, if the hips are balanced, the pelvis, which is this whole complex, and even the rib cage. You may not think about why the rib cage affects it, but we'll see. Because when the body is out of balance, it's like this is a middleman. It takes the brunt. It's right in the middle there. If either or the hip or the pelvis is out of position, again, it's like the knee is the victim. And you have to try and look at treating the cause, not just the symptom. You can, initial knee injury, of course, you put ice, heat, whatever you want to apply to it, but you have to look above and below that knee also. So today, that's what we learned. We talked about just the whole system. It's not just the knee. One reason, this is there are other reasons, but primarily, the knee only moves in one plane. It's not really designed like the hip for rotation. It moves back in, just in one plane, up and down, straight and back. It's not really designed to twist and rotate. That's when a lot of twisting injuries, a lot of times people, I just turned and my knee gave out. Well, if your hip didn't support you right, or your ankle didn't support you right, the knee became the victim there. So then you hurt your knee. That's what the hip or the pelvis, the knee is forced to twist. And over time, it can be a repetitive stress injury. You keep one time, you get minor pain and you neglect it, goes away. A few days later, a few months later, it can happen again. Or sometimes it might seem like a small movement and suddenly, but overall, it's been happening, it's like a cumulative effect sometimes happening over time. Common knee pain patterns that we see mostly, going up and down stairs is one thing. People will have pain either going upstairs or downstairs. Squatting. Now we will talk about squatting. A lot of people work out in the gyms. The way a lot of squats are done at the gym, with the weights behind you, or even goblet squats, if you're not watching the position of the pelvis and the hips, a lot of gyms and everything will show you, will look at the positions we recommend, and you still feel a lot of, you'll still be working your quads or your legs, your hips too, but if you're more in an anterior, we'll talk about, it's like you're standing on your toes more, you're going to strain the knee more. Like heels, sometimes if you get a lot of heels and you're on your exercises, giving you to put a band around your knees or put a band around your ankles, walk sideways, nobody's watching the position of the pelvis again. All that strain comes. IT band pain is the biggest, I see that a lot, but it's most of the time I can guess, okay, what exercises have you been doing? Let's modify it a little, and that helps. Knee feeling unstable, knee giving out. And that again happens when you don't have the stability here, or the ankle, both. Combination of both, or just one or the other. These are mostly classic signs of a hip driven. Mostly this is hip. Sometimes with the ankle too, you don't wear proper shoes. If you have a flat foot, or even a high arch, it's a problem. both ends can be a problem, not just one. The solution is yes, PT helps. What I do is more of it's not a traditional physical therapy approach, it's a little out of the box. It's more called the postural restoration approach because it looks at the whole body from head to toe. Rare cases, like 10% of the population, we even work with dentists or optometrists because that's driving your movement. Podiatrists, like the feet. I mean, we'll just write shoes or a good support, but it's everything. Both ends will make an impact. So it's about balancing and the human body because I don't know, you probably are aware, one side, you both right and the left side is not the same. It's not, and people attribute it to, I'm right-handed, that's why. That's not the only issue. There is, we are looking at the human body. Most of us is there anybody left-handed here? Even if there were, you would still be, all of us, even if you're left-handed, we get biased to the right more. There's multiple reasons for that. You have a liver on the right side. You don't have a liver on the left. That's about 3.5 to 5.5 pounds. You have 3 lobes of the lung on the right. So there's more organ mass and only 2 on the left. That's how we are designed. Your diaphragm is a respiratory muscle. It attaches to the ribs in the front and the spine in the back. The attachment at the back is 2 halves, a right half and a left half. The right half attachment is almost twice as big as the left to support the liver. That creates a naturally occurring asymmetry, meaning the spine is kind of instead of being straight in the middle, it's a little oriented more to the right. So everybody has this asymmetry. Not everybody has aches and pains because as long as you can move back onto the left side and go back and forth, alternating nicely, you're fine. It's for whatever reason if you get locked up on that right side. Now, your right side's most of the time overworking. Left side is compensating because it's trying to pull you, and everybody has a different pattern. We compensate differently depending on our height, our weight, our activities of daily, what you do for a living. Everybody underlying pattern is the same, but how we compensate is different. But a lot of times in what I do, the exercises we teach, we don't do the same exercise on the right as on the left because you're not doing justice. Then how will you get out of that imbalance? One side of the rib cage expands more, one foot hits the ground different, so both we are different. And it's not always the same because how you compensate, if you've started compensating, 2 years down the road, your pattern is going to change. Initially, it may have been your right hip working too hard. 5 years down the road, it may be your left hip because that's trying to now fight and pull you back. So it's the pattern keeps changing over time. These naturally occurring patterns can now overload one knee. And I'll show you some examples later on myself. How patterns affect the knee. The femur. Now, femur is this bone here, the thigh bone. With the pelvis going forward, the femurs, most of when you're anteriorly tilted. See, when I do this, see what happens with my knees? They go in. Again, I'm exaggerating, but you can see that a lot of times you'll see from the wear of your shoes, wear pattern on your shoes, where your weight is falling. The tibia, which is this bone, will either rotate. Initially, it will rotate the same way now, but over time it can compensate. Now you have that torque in the knee, depending on which way you're going. The knee collapses, and most of the time it starts with the knee collapsing inward because of the anterior tilt. Quads work too hard, and hamstrings and glutes shut off. They work less now and yet what do we do? What is the typical? 20 years ago, before I knew about postural restoration, and in school we were taught, strengthen the quads. So what are the number one thing that people do? You strengthen the quads, you put an ankle weight, you sit on the machines. Hamstrings get neglected. They get stretched more of it. Yes, there's a machine that works on hamstrings too, but if you strengthen that with the pelvis in an anteriorly tilted position, you're not really doing it full justice. You're not working it in the inner range. And over time, I'm just throwing out a number, but 80% of the time, the quad hamstring ratio is different. The quads work a whole lot more than the hamstring. So that imbalances the knee. The postural restoration approach looks at, there are 3 main steps. Repositioning is first what we do. The very first thing that we look at is repositioning, is relaxing the pelvis, because realigning, I should have said realigning the pelvis in the rib cage position. That itself will reduce knee pressure, because if I'm like this, it's tipping, that's so much pressure in the front of my knees. But if I can shift my weight back on my heels, get neutral here, now there's less stress in the knee. And everything realigns. And again, right, you'll do the right and the left a little differently depending how everybody presents. So there are some cookie cutter basic exercises, but they may not. You have to kind of fine tune them to every person because it depends on what your issue primarily is. This postural restoration approach helps you use your hamstrings, your inner thighs, mostly the left a little more than your right. Glutes, both sides, but the right side we need the bigger glute called the glute max more. Left, we need the glute med, which is, that's the weaker one because so you work them a little differently. And stop overusing your quads. That's the number one thing. So when the hips work well, knees also can stop hurting. Okay, restoring natural walking. Now you relearn how to walk. Your shoes play an important role. Good shoes. Actually afterwards I can, Rashmi, you'll have the list, people, right? I'll just give you some, send you an email. You can send the resources to everybody. The newer shoe list just came out and I haven't had a chance to look at it. That's why I didn't want to bring it because I don't know enough to talk about it. But the Postural Restoration Institute, which is in Lincoln, Nebraska, they go out, one of the therapists there goes out every year because shoes, what happens, unfortunately, what's a good shoe? For some, you'll say you liked a Brooks particular model from last year. The shoe companies, unfortunately, change the model next year. So that same shoe may not be good for you this year.
Yeah.
So I didn't have enough. It just came out last week. So, but I'll give you the, you can have access to that, and then it gives you in some of these. That's a basic exercise. 1990 hip lift is one. I use it. It's not just for knee pain. That's probably my number one. 9 out of 90% of the patients that I see, that's the first exercise we do because it realigns both the hip pelvis and the rib cage. Left adductor. The reason I said adductor is the muscle on the inner thigh on the left. Guess what is happening when your pelvis goes forward and to the right? You see the difference in the two. See the left adductor. What happens to it? It gets longer. The right adductor gets shorter. Again, this is an exaggeration, but you see. So the left needs to be strengthened and the right needs to be relaxed, inhibited or stretched. So we do the pigeon pose and everything. Are lying on your back and you do the knee to chest figure 4. You need it more for the right side than the left because the left you're going to overstretch that adductor. You may feel it tight, but it's tight in a different part of the hip. That's why that movement feels. But the right adductor is so we only do that on one side most of the time. A wall, because now this is what glute med activation. I should have put glute max. Glute med, like I said, on the left more. That's more important on the left to rotate the leg back out. On the right, you need the bigger glute. But for the most part, basics. A lot of times you restore these other positions or these other muscle alignment, everything else starts working better because now your muscles are in a better position to start working. So this is one of the typical exercises I usually. You're lying on your back, feet on the wall, and it's not a bridge. You see her back is still on the wall. Reason we use a balloon, we don't have to all the time. Initially I started without because people are, there's too many things to do, 100 things to do in that one exercise. So it gets confusing. The first time I generally will not use a balloon unless I don't see the chest moving down at all. Because rib cage is elevated, the balloon helps with that. We're only reaching with the right arm because remember I said we've got to get you shifted to the left. This one exercise can drop this left arm back down. 5 breaths. You're holding the position for 5 breaths in and out. If you Google the name of the exercise too, you'll find videos. People have put up videos there. So but basically it's working. You're not pushing, but you're pulling the heels down. So you're working your hamstring. When we first start, I have people usually put their feet on top of this. The second step is usually the right height for everybody because when the hamstrings exercise on the same thing on the right side. Because remember I said you need a left adductor, left inner thigh muscle. So here we've positioned her foot resting on a bowl. This is a little bit harder one, but I just wanted to give you an idea what muscles we are trying to reach or work. Again, breathing is a big part. I have the same exercise. People use the balloon too on this. But balloon is not. It's mainly I'll insist on the balloon when I don't see when people are so tight that your chest is barely moving. It's like when you are in an anterior tilt, this is how the body you raise your rib cage. And another thing we raise our rib cage, reason we raise it, Everybody tells you to do what? Sit. Good posture is sitting up straight. Well, guess what? We are sitting up too straight. We are overcorrecting. So I see this all the people are doing this. This is causing neck tension. I'm not saying do this. All I'm saying, find your sit bones, relax. Your good posture is you should not feel your muscles having to work. It should be relaxed. So that it'll feel, I want people when they first come, when we're going over to repositioning, sitting, how to sit, stand, sleep, you're going to feel very slouched for the next 2 weeks because you're used to your center of gravity being here. I'm pulling you back, now you're sinking, but then I show them pictures from the side, how they're sitting, and they're straight, but they feel slouched because I'm taking them away from this. So it feels slouched, but if you think of it this way, if you move your center of gravity, your foundation back, this upper part, now that's more work. That has to go back, so you actually get more upright. A lot of times, the 90-90 exercise we did, I showed you, people will do that and then they get up and say, oh, I'm taller, or I feel my weight on my heels. Or we do the squat, which I think I've got next. We do the squat, but we're actually having you reach forward. So it feels like you're slouching and rounding your back. But when you get out of it, because you shifted your ribs back, you pushed air into the back of the ribs, you're taller. Because your weight is on the heels, not forward. The next one. So this is one. Again, there are different versions of this. I pulled the little advanced version of it only to show you. There's a ball there again, but you're using your left inner thigh. You have a balloon on the. You can do it without a balloon. Same thing. Just long. We all recommend doing a longer exhale than the inhale, getting all the air out, because when your rib cage is elevated, which 90% of the time you are, the left side more, this is where you are. That's neck tension. Just try sitting up like this. You'll see that, feel the tension in your neck. But if you breathe out and let the chest drop, now your ribs, now you've shifted your weight back. And the diaphragm is now in a better position to work as a breathing muscle, not a spinal extensor. When you're with an anterior pelvic tilt, your diaphragm, and Reena, you'll probably agree with me, it becomes more flat. So now this is your spine, this is the front. If your ribs are elevated, now the diaphragm is going to help you do what? Back extension. It's not meant to be a back muscle, it's meant to be a better breathing muscle. So even start breathing better after with these.
So why does she have that book?
It's just to show how far to stand from the wall. About 7 to 10 inches. If you're too close to the wall, your weight's going to come on your toes. So generally that 8.5, 9, somewhere between, for most of us taller people have to be further away. But otherwise your weight will not stay on the heels.
Okay.
And in that they're also doing it a like, feeling something behind your heels activates your hamstrings too.
Okay.
So it's like a proprioceptive effect for that.
Is that why when I went to a class and then when we were doing, they were
Squats?
Squats. She was saying that please make sure that you're putting weight on your heels,
yes,
and not your toes.
Correct.
And even if you have to up your toes
sometimes.
it'll
Toes
be
you
there.
don't want to do too much of because then you'll work your shins too much.
Yeah.
So you just have to be more aware of your heels, yes. So 10 things you can do today. Definitely breathe with your ribs down, meaning let your ribs go down versus here. Now that's tense. Now that's sympathetic. You're in the fight and flight mode. Side more. Your hips and rib cage too. Your hips you probably knew affect the knee, but you didn't know the rib cage affects the knee. It's because when your weight is forward and you can't breathe into the back, now weight is forward. So if you learn to, your rib cage, we should have 360 breathing. You should be able to breathe all around equally. Especially, we are very limited usually in the back. We don't push our ribs. It's like we call it rib cage retraction. We need to be able to move back. A lot of back pain, hip pain will resolve with that too. Breathing and posture matter. PRI's posture restoration helps your body move the way it was designed. And when the system, but underlying the injury was this pattern. So yes, we treat the injury by doing more mobilizations, manual therapy, anything else. But we still have to look at this because underlying that, we can't get you fully if you just treated the knee. So you would still need to do the whole thing. Yeah, I think that was it right now.
Yeah.
For giving me this platform every time to showcase my skills and abilities, and finally we are here on the screen, and the session is about the mudras. So basically, if you're thinking that I'm going to give you the mudras for your hair fall, for your skin, for your weight loss, for your diseases, the answer is no. That you have, see, you have ChatGPT, you have Google, and why would you want to waste a time in that, right? But the bottom line is where we always get confused is over knowledge. Whenever you find it out, okay, I have this issue, let's go, let me search which mudra. There are, in the same disease, you'll see a lot of mudras. And then again, you'll get confused. Okay, should I go 1, 2? And internally, you don't know where you're working on. So the bottom line is, I'm going to show you today how you're going to guess or how you're going to observe your own patterns, your body pattern as per Ayurveda. First, we need to understand a little bit of philosophy, that how mudra works, when to do it, how to do it, and at what level we should do it. Slowly, when we move further, we will get to know that how many types of mudras are there and how they work on your body. But behind it, what is the yoga philosophy? What is the main science philosophy to go with this mudra? And I have made it very easily, like a step by step, like kindergarten to middle school to your high school. So you'll understand, you can connect your thoughts. Okay, now I have this, I should be going this and doing this kind of things. So you won't get lot of knowledge. You know what you're searching for, right? Now, next, this is a quick, to do this. Yes, these are my reviews for my classes. So I'm a yoga instructor, and I work on holistic way. I don't teach the way with the cues. So first, I work on anatomy, that you need to understand what you're doing and how your body posture should be, because every person has their own postures. It's not necessary the one pose is suiting me can be suitable to you. It's same with the breathing pattern as well, and that's what Sangini was covered also. Like every posture is important, and from where the posture comes, it comes from your whole routine, how you sit, how you stand, how you walk. And these are some of my reviews. There are many reviews, but these are the one which I loved it most, and that's an actual success. They worked with me from 1 year with some of the prenatal, some of the infertility rates. So we have covered this, and these are the information for my classes. I have kept it over there. Rashmi, would you mind just spreading it out, all the slides?
This is online?
This is in person and online both. So I don't want my student to miss the class. That's why I kept it open. The prana in the later sides. That is the motor, is the prana which I mentioned before. Now the Hasta Mudra, when you talk about, there are 5 kinds of Hasta Mudra. The Hasta Mudra first means a hand gesture. Whatever the mudra you take it, that's called a Hasta Mudra. But sometimes when you work for your health, for your inner health, Hasta Mudra is not only one thing, but it is about the another mudras as well. Like you're sitting, you're holding, like if you watch it, you're holding this way, or you're sitting this way, or you're sitting this. So these are called also mudras. The second mudra is the Manna Mudra. That means the Manna Mudra is more about your, eyes, from your face, from facial. Like, in Bharatanatyam, they do this eyes. Mm-hmm. So that's also in the mudras. And these mudras, when we teach asana, so I take these mudras, like look straight, look forward, down, eyes up, back straight, roll your shoulder back, pelvic tilted in, sacrum, little posture, whatever posture you sit in, it's called a Kaya Mudra. After Kaya Mudra, we called it as a Bandhas or Shakti Mudra, the most powerful. I love these kind of bandhas. So so whenever you're using for example, if you have a uterus issues, only might be hand mudras will not be the good, selection. Might be the Adhara Mudra. That means the mudras, these techniques refers to prana that lowers the central of the brain. Mudra concerned with the sublimating the sexual energy are in the group. The girls who are feeling the nowadays 21, 22 years, I'm treating those girls for PCOS, for PCOD, for a lot of cramps, right? Maybe swelling in the uterus. So these comes only with this mudras, can be solved with this mudras, I can say. And the mudras, you'll see the names about how to we go. So see, Hasta Mudra. Now, if I talk about, I'll just name a few because these are the most powerful mudras, which I really love to, practice with my. Yeah. So if you'll see the Janan Mudra, Chinna Mudra, you'll see the shades. The last one which you see about the Yoni Mudra, I would say for every woman, doesn't matter how old are you. From the day you get your periods, from that point till you're alive, Yoni Mudra is always regulate towards the perineal, towards the lower part of your body. And you have seen after 40, or maybe especially for menopause, you see that this part always get increased. Doesn't matter, your weight doesn't increase, only the posture will changes, right? So yes, it is depend on your muscles, it is depend on your posture, it is depend what you eat, how you move and how you think. But this mudra, the last Yoni Mudra, will help you. I can say this is the beautiful mudra which everybody should practice it. If you see the Manna head mudra, there are so many names in it, and I have put the pictures as well, so you can see the pictures and see there are a lot of changes. Like Shambhavi mudra, it's an eyebrow center. We always look to it. There are some mudras when you take your tongue out and you have to look towards the tongue. So these are the mudras which you can take it and you can easily choose which direction you want to go with. What direction? How? We are going to see the later. Kaya postural. These are the postural, which is called a Viprit Karni. See, you can see the posture. So last posture is my favorite, which is 99% people cannot understand it. Whenever I explain them Paschimottanasana, they're like, for them Paschimottanasana is to touch the head on the knee. I said, okay, but what if you're not able to do it? So the first mudra you're taking is this. You need to understand how should be your back, your toes, where should your hands is going and where you're looking. That's a first mudra, which is very important. Adhara mudra. This, I would say that all teenagers should be knowing about this. How rectum works, because most of the time they stay out, what they eat, they even don't know, due to lack of time, due to lot of more accessible things or home food. The most important mudra in everybody's life, doesn't matter male or a female, is the Adhara mudra. Adhara mudra can be done for male. For the male is different, like that's why I wrote it down for Rajoli and Sajoli. So for the male it's a little different type, but the thing is that almost the steps are same. Ashwini mudra. So Ashwini, if you see the anus point, the circle, the brown circle, you have to lock that and you have to release that. Now if you're suffering from constipation, early morning, go for have a little warm water and then squeeze your anus, release your anus, squeeze your anus, release your anus at least 20 times, and you'll see the result. What it does basically, okay, let's move to the other. Now I have designed this with the help of AI. Sometimes I like AI to help me in the solutions. Just imagine that मैं gross body पे हूँ, a human is there, the piece is there, right? In this road map, if you'll see, the koshas are there, like a steps. Step 1 है, step 2 है, step 3 है. ऊपर जाने के लिए हम काफी stairs cross करते हैं. लेकिन अगर हर step में if you have a knee pain or a back pain, now you imagine कितना tough हो जाता है ऊपर जाना, right? So these pain are these klesha, and I named it as a blockage. It's a beautiful roadmap. Try to understand it. If you will understand this area only, 50% of your job is done. Then you have to just work on yourself. So see, first is Annamaya Kosha, which is a physical body. So between physical body and job आएगा ना तो उसके साथ दूसरा अच्छा job आता ही है. You always get confused. हमेशा you'll see, even with the choosing a sari color, if you are selecting a one color, she will show you the another color and you get confused. There the we call this kalesha kam. Also in Hindi, ghar mein kalesh mat kar. When we say kalesh mat kar, we are talking about avidya, amista, dvesha, raga and abhividya. So I'm talking about all kaleshas. So while doing mudras, not only we are redirecting our pranas, but we are working on these kaleshas. So your question may arises, Reena, blockages we understood, mudras. What is mudra? When you say theek hai, we understand you have a mudras and you're locking and you're working for your pranas. What happens with the mudras? We call it as a vivek, a zamir in Hindi we called it, and that vivek is called a solution. When you work for any seal, you redirect those prana accordingly in that part of the body, in that part of the organ, in that part of the awareness, mental issues, and then we called it as a mera vivek jaag utha. सो रहा था अभी तक, ह्यूमन है नहीं, बिकॉज आई क्रॉस्ड दीज कलेशा, तब आपका विवेक आता है, राइट? सो यू वेन एवर यू सी, अरे इसके साथ इसने ऐसा कर दिया, दे मर्डर्ड इट, रॉबरी हो गई, लाइक मदर फादर के बीच में ये हुआ, वी ऑलवेज से दैट इंसानियत कहाँ है. वी डोंट से इंसानियत कहाँ, वी से विवेक कहाँ है, बिकॉज विवेक को जानना. आनंदमय कोशा वर्क, हाउ प्रणमय कोशा वर्क, एंड हाउ विज्ञानमय माइंड एंड द विजडम वर्क, एंड हाउ देयर इज अ clarity of these slides. Now, when we talk, as I said, that Vivek is the right understanding, self or your body, mind का difference जानना पड़ता है. शरीर, दिमाग और विवेक, तीन के अंदर का addition है, connection है. And that connection we start with the mudras, because it generates, regulate those electricity, or I can say channels in your body. Vivek आने से क्या होता है? Deeply about the pranas, but to know the step like what is pranas. So जब हम pranas के बारे में बात करते हैं, so far we understood the kaleshas. Kalesha means the inner disturbance, fear, attachment, confusion. But kalesha is not only the mental experience, सिर्फ वो mental experience नहीं है. When the mind is disturbed, the inner energy disturbed, and that's why we take a short breath, long breath, or sometimes we don't breathe. Yes, that's true. Sometimes we don't breathe, not knowingly, unknowingly, because we say that your lungs breathe automatically. अगर मैं आपको एक बॉक्स में बंद कर देती हूँ तो 5 मिनट तो आप फिर भी जिंदा रहोगे. क्यों? वहाँ पे ऑक्सीजन नहीं है, फिर भी यू आर अलाइव, राइट? सो दैट्स व्हाई द इनर एनर्जी गेट डिस्टर्ब. इन योगा, life energy is called prana, and in my classes I always worked on these pranas, that you should be redirecting yourself where you need to go. And there are many ways we can observe this life force. So prana is a vital energy, which I have written here. It supports breathing, movement, thinking and digestion. Prana connects the body, mind and overall well-being. Balanced prana supports health and calmness. Disturbed prana can create a physical and mental imbalances. I love this last point, that's why I have underlined it. Balanced prana support calmness, harmony and well-being. That's why Dr. already subtle body and the casual body, and these bodies, in all these bodies the prana flows. Breathing and pranayama help balance the pranas. Prana helps increase the retain the prana. So prana ही है जो retain करते हैं दूसरे pranas को. कैसे? वो हम आगे जानेंगे. Now when I talk about the prana, so you see prana is an energy. I say yes. If you see the left side, it's a journal way of food हो गया, गाड़ी के लिए fuel हो गया, toys के लिए battery हो गई. That's called a prana. Energy exists in many form, which serves as a different purpose. हर किसी का purpose different होता है, तो इसीलिए उसका battery भी different होता है. किसी में 2 battery लगता है, किसी में 3 लगता है, right? So that's why. Similarly, prana is a subtle energy that powers various aspects of beings. To understand first yourself, to understand before the elements and everything, you need where you are redirecting your energies. From where you can see the map where pranas, खाने में है sun, vayu and sunlight, I can say in the water. Prana is present in all these things. So now this practice, yogic practice like breathing, meditation, connection with the nature, all these things help to increase and balance our pranas. So the question is, acha, how do I know that it's an imbalance and the balances, right? That's why I said you need to understand what kind of energies you're carrying it. And how does its prana works? You can see the picture. हर जगह पे प्राणा है. जितनी भी लाइट आपको दिख रही है हर जगह पे प्राणा है. You see the fingers. That's the black part. That's called a circuit. हर टो की फिंगर से, हाथ की फिंगर से, and especially the neck part, जहाँ जहाँ पे आप देखो shoulders के part पे, जहाँ कुछ कुछ parts पे you can see the black highlighted part is there. There is a direction of your pranas. It presents everywhere in around the body. Prana functions like oxygen. So you take oxygen, yes, there is a prana, but oxygen is not just the one way of a prana. The diagram which I showed you, that's are the ways of the pranas. These are the prana diagram. I'll just quickly, with a few seconds, I'll explain it. Diagram sab bata deta hai. You can see the diagram where you have the apana, that means pelvic to feet. The energy goes here. Your prana flows here. That's why the urination goes down. Babies come down. One, the gravitational force, but your prana is exist, which is moving down towards the legs. If you go more, can you see that half semicircle crescent, right? Now this is called Vyana. Vyan is in your whole body. That's why if you put the semicircle here, and if I'm just putting pressure in this, it will tick tock, and come back to balance. Because the nature of that is the Vyana. Vyan is everywhere. If you see the Samana, can you see the middle and see the upper and the lower? That's why it is named as a Samana. वो ऊपर की तरफ भी equally जाता है, नीचे की तरफ भी equally जाता है. That's why, and the dotted line is your diaphragm. If you move towards the prana, towards the chest, it's respiration, circulation, temperature, feeling, thinking, सब यहाँ से आती है जो हमारे दिमाग. इसीलिए whenever people talk sometimes which is not sensible, in Hindi we say आप पागल हो गए हो क्या? Are you crazy? Right? Are you gone mad? Are you crazy from the, like, what are you thinking? Why? The whole pranas is coming here. That's why we are disturbed from here. Udan, throat se head ki taraf jata hai. This is the most important part. Most of the time people use only Udan and prana. They don't use apana, they don't use samana, and that's why first thing, if you go down to up, if you see the benefits, right, from mudras. So first thing comes your circuit, your pin. Pin ऊपर चला तो किसके ऊपर काम किया? प्राणा के ऊपर काम किया. फिर वो ऊपर चला तो उसने क्या किया? जो भी hurdles थे, जो pathway I have showed you, that kalesha was there. So kalesha को उसने regulate किया. And when I say kalesha को regulate किया, that finger represents the elements. Elements carry pranas. And this prana moves through vayu, and balance the vayu creates the health. Now kalesha, disturb the koshas. Disturbed kosha means to disturb prana. It's like a loop. And then mudra works by balancing these pranas through fingers. So we have just seen how the prana works in the body in a different way. And there are 5 pranas which I already explained you. And the bridge, basically, the prana is closely connected with the 5 elements, and this 5 elements expand the mind and the nervous system. What are the spiritual benefits? Supports deep meditation and the inner awareness, help awaken pranas and chakras, encourages the inner stillness. These are the important things about the mudras. As far as possible, the hand should be face upward, not the downward. In some mudras, there are the downward, but there are only 2 to 3 mudras you will see there's downward. Always it's upward, right? Doing the mudras, अच्छा upward क्यों? ये तो क्वेश्चन किसी ने पूछा. Why? I'll give you the answer. We talk about the pranas, right? And chakras. It's more towards the Sahasrara chakra. Where we want to go? Here. It's a subtle. That's why it is always to be upside. It's not a downside. We don't want to go. We are already stuck in the earth. subtle gross body. Subtle body is up, subtle is light, it's up. So akash, space is up, that's why. If done for 50 minutes, desired will come. That's will also again will teach you the patience. Okay, while doing the mudras, only the tip of the fingers are used. Pressing the tip fingers is not needed. दबाने की जरूरत नहीं है. Nails के ना वो आ जाते हैं marks. It's not necessary. Other fingers should be straight. If you are taking this is mudra. No, this is the mudra. If this is down, both the side is down. See the basically typically when we go for a Vishnu mudra in pranayama, people say, oh, my fingers are not getting up. And then we say it, cross it and open it. See, now it's completely straight. But this is just the initial line. We are not mixing the two elements, right? Just to know about it. I think sometimes breathing is also relaxing for your joints or any part of it. But this Anulom Vilom, the next, we have 5 more minutes and I'm going to give you a practice of this, which I would love if you can do it, together. So see, before Anulom Vilom, before reaching, or people they have shown you that, or ask you to go for Anulom Vilom. Okay, you will get to know, okay, Anulom Vilom, inhale, exhale, but speed से भी पहले आता है. Next slide. This is the most important part of your breathing. Before going Anulom Vilom, you need to understand what part of your body you are using. That's why whenever you go for the physical therapist, when they explain you in the first 2 rounds, you won't get it. Then they have to slower down, and then again they will talk about it. Okay, pelvic in, this in, open your chest muscles. So, wide your chest muscles. So the first thing you need to understand the sectional breathing, and we are going to practice this. Now sectional breathing is 3 parts. Your tummy, okay, you called it abdomen. The second is this chest part is your thoracic, and your upper is your cervical breathing basically. And if you see the arrows, right? Arrows are the beautiful things in this diagram which will show you what is their interior posture, what should be the exterior posture. And this the first practice you before Anulom Vilom. This is the practice. Now if you just sit both the hands on your knees, try to concentrate just for a few seconds only. Try to concentrate on your belly button. You inhale deeply, exhale completely. Don't touch it at all. Just try to sit and just concentrate. Your whole pranas is regulating towards your belly button. You inhale deeply and bulge your tummy out. And exhale from your nostril, squeeze your tummy in. This is called an abdominal muscle breathing. In Anulom Vilom, you have to reach this part. But directly reaching this part can be harmful for your breathing, for your body. Keep going. That's 5, 4, 3, 2, 1. And then with this pranas, awareness, move the chest part. Now in this, make sure you're not paying concentration on your tummy, but still the tummy is expanding. Now you feel the slight changes in your chest muscle when you're inhaling. Observe that the chest muscles are rising high, and while exhaling, it's falling back on the place, which is the movement of your diaphragm basically, but we never notice in our journal routine, in our daily routine. So while inhaling, inhale while moving your chest up, exhale, moving your chest down. From there, take a deep breath in, bring your whole concentration, your prana towards your shoulder, and try to roll your shoulder back. Now take a deep breath in, lift your shoulders up. Imagine that your shoulders are going to touch to your ears, ease at all. Keep throwing it back, and exhale, squeeze it back towards the center. One more inhale, lift your shoulders up as much as you can, extend it and release it. Last round, going inhale, one more round. Exhale and relax. You can open your eyes. Now when people will teach you Anulom Vilom, you'll understand when you inhale, the first breath is going from your nostril, then your throat area, then your shoulders, then your chest, and then your tummy. Sometimes if you do Anulom Vilom, people say, I can feel my breath till here. What is here? It's an abdominal breathing. So before understanding the Anulom Vilom or moving to the Pranayama, you need to understand this, that am I using my all these three not. So people in my Pranayama class, I just teach them for a 1 or a 2 month this. Then they are moving to the Anulom Vilom. Anulom Vilom are not to be taught directly if you don't understand the way of your pranas, where your prana is going. Once you understand it, you understand कि मेरा breathe कहाँ मुझे भेजना है, किस part को ठीक करना है, और उस ठीक के लिए mentally कैसे ठीक होना है, और मुद्रास का कब कैसे use करना है, right? Yes, the end. And as I said, this is my favorite quote. And I have just kept it this one. I just need a favor from you. If you are on Instagram or Facebook, you just follow me. I have this all information here. My classes are there. I work on Mondays, flexibility and stability, and in the movement, that what Sangini explained, that some part of your post, like some part of our body, like our right is sometimes more strengthening, but if you see, you're more flexible from the left. It's vice versa for everyone. It's not same for the everything. I can be best from my right side, but I'm not good at from my left side. So this class is like this things that I teach in deep muscle. On Thursday, we have a power vinyasa, and fat loss is just a business name to stick on my flyers. So basically I call this as a Ashtanga yoga, and Tuesdays and Thursday morning I have the for women's 9:30 a.m. class. It's just the lowest price in our area. And the teen class is also there, prenatal classes are the one. I'm coming up with a weekend class. I'm going to advertise it for already the classes. I have 5. I'm just 2 people away. So this is the most powerful practice. I named it as a S3 flow, which is important for your after 40s. Doesn't matter you're on 40s or not, but I should say you should start practicing after 33 this flow called as stretch, strength and sculpt. It's a mixture of pranayama, weights, body weights, and the deep stretches. And this is the new session I'm going to introduce on weekends. It's a 7:30 a.m. and these are the things which I cover